Can I also ask you about COVID restrictions? Saskatchewan today announcing that they're getting rid of their mandatory vaccination card system as of Monday and ending indoor masks as of the end of the month. Alberta has a plan they're announcing in an hour or so. Where is BC on moving up the end of these restrictions? What would you say to people who are looking at the other provinces and hoping that we're going to move that quickly as well?
Well, I would suggest that we're going to follow the same path that we have been on since the pandemic began, and that is to take advice and counsel from public health officials who are working with our acute care system and working with others in the community to make sure that we're continuing to protect people. And restrictions, direction and advice on restrictions will come from the Public Health Office in the days ahead. She's made it clear that she has plans for Family Day, which is coming. I will say that where we have had success is ensuring that workplaces have plans in place to protect workers and to protect customers, and that should continue beyond the pandemic. I believe that masks are effective in protecting people, and I don't believe that an arbitrary decision by an elected official is the best way forward in that regard. And similarly, the immunization cards supported by the vast majority of people to ensure that the sacrifices that they've made have provided benefits for them and their families going forward. And we'll just see where Dr. Henry wants to go with all of this. She hasn't advised me on her plans yet. I have a vague idea based on hospitalizations being stable, cases coming down. And with respect to other jurisdictions, everybody's addressed this in a different way. And I'll put our record up against all of the other provinces in the country, and outcomes have been better in terms of mortalities, in terms of impacts on the economy. Clearly, our unemployment rate is 5.1%, leading the country, created more jobs than existed before the pandemic. I think there's a lot of positive to say about how we've got here, and it all is a result not of government policy. Specifically, it's about British Columbians recognizing and acknowledging that they have a role to play to protect themselves, their families, and their communities. And I don't believe that's going to change because of announcements in other provinces.
Next question is from Binder Sargent, CTV.
Hi, Premier. Just following up on what Rob asked there. Just wondering, you said you have a big idea. Could it be, you think, weeks or months? And do you think that those other jurisdictions are bowing to perhaps political pressure? Because we have heard some politicians there supporting the convoy in Ottawa. You've had a protest there outside the legislature today. So just if you have a bit of a sense on sort of what that timeline could look like.
Well, again, Dr. Henry has made it clear in her briefings that she will have more to say next week. So I'll leave it to her to bring that forward. I wasn't trying to be obtuse there with the question that came from Rob. I understand the work that the public health officials are doing with Minister Dix and others to ensure that we're in sync with the public and the virus, not in sync with a handful of protesters. And having said that, I do absolutely recognize the right of people to dissent to public policy. I come from a party of dissent. I couldn't count the number of protests I've been to in my life, starting in grade 7 and going up until recently. But that does not, I don't recall at any time ever trying to deny rights of other citizens. I don't recall at any time participating in anything that involved threats and intimidation to other citizens. And I would hope, it's not just the convoy movement or any other movement that seeks to put themselves ahead of the rest of British Columbians. That's just not on in a democracy. We certainly welcome those who want to exercise their right to dissent, but we do not, and I don't believe the vast majority of British Columbians support intruding into the lives of other people who are trying to get on with a very challenging time. So I'm hopeful that people will continue to express their discontent in a way that does not interfere with the lives of other people.
One of the mentions in the throne speech is about how the end days of this pandemic will be in months and not years. I think we all anticipate that. How crucial is getting people back to work as part of driving the economy again, getting people back on transit, getting people back using downtown restaurants and coffee shops? And what will the government do to help push that back? Will there be an encouragement at some point to get people back in their traditional workplaces?
Well, certainly that's the objective, not just for the government, but for businesses, for workers, for families. People want to put COVID behind them. I get that. I'm at the front of that line with Dr. Henry and Minister Dix. But we want to make sure that we don't do it in a reckless and cavalier manner just because people are honking horns. A small minority are honking horns. We want to make sure that the sacrifices that businesses and workers and communities have made over the past 2 years are not just thrown away because of some noise out on the legislative lawn or in the capital city of Canada. Having said that, I absolutely understand that people are done with this. I live in a community. I have neighbors. I talk to people all the time, and we want to move on. They want to move on. We all want to move on. But we have been successful by following the guidelines and the hard work of public health officials, led by Dr. Henry and her team, and making sure that we're supporting the acute care system that's so fundamental to the delivery of emergency services to British Columbians. And as hospitalizations start to decline, we're in a better position to take actions on restrictions that are in place and be more encouraging of people to get back in the game, get out there. And I was delighted to see stakeholders in the education sector agree to renew tournaments for young people. I remember as a high school student how important that was to my development, not just with respect to physical fitness, but socialization, the notion of teamwork, working together, collective purpose, common goal. These are fundamental issues that are part and parcel of our K-12 system that have suffered because of COVID, and I'm grateful that that's starting to come back. And it's examples like that, I think, that people want to see, and they hold that up as some symbol of hope that we're getting to the end of this.
Follow-up, Richard?
How crucial are lifting these capacity limits to help reinvigorate the economy, and how crucial are moving beyond restrictions to drive the economic plan and the budget that will come out of this throne speech?
Well, it's critically important. Minister Callon will have much to say next week, and of course Minister Robinson even more the week after. We are looking again at one of the hottest economies in the country, but one of the biggest challenges, and that was highlighted by the labor force data last week, 1 million jobs will go wanting in the next 10 years if we don't start a human resource strategy to meet those vacancies. And you've been covering, you and others in this room and across the press gallery and media have been covering the challenges that employers are facing trying to find people to fill vacancies. And in areas where there is uncertainty, like hospitality, it's harder to encourage people to wait for their job to come back when other opportunities are presenting themselves because of a hot labor market. So working people have more options today than they did 5 years ago, and that's putting a strain on existing industries, and they're looking not just to government but to the marketplace to find ways to meet their needs. And we need people back and moving around and spending their discretionary money on a night out, gifts, retail activity that's not internet-based, I would suggest. And if anyway, I'll leave it at that.
Next question's from Lisa Yuzda, City News.
Premier, you have throughout this let health take the lead, but we are seeing other premiers go more in front of, the next steps in the pandemic. And I'm wondering when we will see that with you, and are you feeling pressure when you're seeing other provinces and other premiers, for lack of a better term, taking the lead with this?
Not at all, because I talk to the premiers and I know the grief that brings with it. So, and I don't want to leave the impression that I'm passing the buck to Dr. Henry, but she is far more equipped and able to understand the data and translate that for the public than I am. And I said to my colleagues 2 years ago that if they felt that being the intermediary between the experts and the public was a good idea, I thought they were wrong, and I continue to think that's the wrong approach. Having said that, as you'll know, I have been continuing to work not just on the pandemic issues, but working to try and get a renewed interest from the federal government in the Canada Health Transfer, which sounds like an administrative or accounting practice, but in fact it's about the resources we need to hire the people to provide the services that will reduce wait times, that will get better outcomes for cancer care, for a host of other things. So those are the areas where I believe I can be most valuable, to use my experience and my persuasive abilities to move issues along. I have had from the beginning an approach to cabinet government that I have very capable people around me that have more than enough experience and ability to do their work without me meddling in it. And it's just the approach that I've had from the beginning, and I don't see any reason to change that now. I have confidence in the people that are making these decisions. I have discussions, I disagree, and then we talk things through. And that's, I believe, a better way for me to use my abilities to meet the needs and expectations of British Columbians than to be standing here, quite frankly, every day trying to interpret the issues that Dr. Henry and Minister Dix know way better than I do. So why would I get in the way of that? As we move into reopening, as that happens, I'll be standing with the Minister of Finance, I'll be standing with the Minister of Economic Recovery and other ministers to work through these things. But it's my view, and I don't see any reason to change it, that I have capable people. British Columbians can have confidence in them, and I'll do my best to support them whenever I can.
Lisa, do you have a follow-up?
And just regarding the months comment that's in the throne speech, that, taking care of people's health in the months ahead, coming out of the pandemic, is that an actual or an aspirational look at what's coming ahead? And when you're talking about, how your neighbors and so many people, how all of us are just sick of the pandemic, I'm wondering how, when the winter comes again, and Dr. Henry's talked about that it's going to be, essentially another brick in the head, how would you claw back and put in any restrictions again, when people are in this place of being absolutely fed up?
Well, again, that's up to the data. That's up to the information. And we're not going to stop monitoring and tracking this information when we reduce the number of times we have press availabilities. We're going to continue to do the work. And as the evidence presents itself, we'll lay it out for British Columbians and we'll have that discussion. But I don't want anyone to interpret the word "in the months ahead" as meaning we're months away. That's a statement that we have work to do, and it's not unlike our response to flood recovery, the extraordinary challenges in Lytton. We have a ton of work from last year that we need to keep working on, and we don't know what the future holds, but we need to be prepared for any eventuality, and that's why we're working on a whole bunch of fronts. So when I say the months ahead, we're going to continue to have health challenges. We're going to continue to have environmental challenges. There are going to be challenges for our economy if we don't find a way to bring more skilled people and even unskilled people to play in our economy. 5.1% unemployment at a time when other jurisdictions are seeing an increase in unemployment. This is more people came to British Columbia in the first 3 quarters of last year than have done so since 1972. That's international immigration as well as in-migration. So people are coming to British Columbia, and we need as a government to make sure that the services they need are there and that they can contribute to the economy and be their best selves as they put down roots here.